Hello, everyone. Welcome to today's webinar about the Walk Cares Fund. We are going to wait a couple minutes here just till about 11 o'clock to allow folks to join. But thank you all for joining us a little early, and we'll get started soon. And welcome to everyone joining us now. We'll wait a little bit for some more folks to be able to join us, and then we will go ahead and get started with today's webinar. All right, so welcome and thank you for joining us for today's webinar on the Walk Cares Fund. Today we'll be covering Walk Cares basics, what workers need to know. My name is Sebastian, and I am the Walk Cares Fund Outreach and Language Access Lead, joined by Sam, the Walk Cares Fund Communications and Marketing Manager, who will help moderate the Q&A portion. Together, we'll be hosting today's presentation. The DSHS customer care team will be answering questions in the Q&A function during the presentation and will be joining us later for the Q&A portion of the webinar. Anyone who has joined us on a computer or using the Zoom app on their phones can submit their questions through the Q&A function at any point in the presentation. And if we're unable to answer your question during the allotted time today, you can email us through the Contact Us form at walkcaresfund.wa.gov/contact for a response. We do have simultaneous translations available during today's webinar. To listen to today's webinar in a language other than English, you can click the interpretation feature at the bottom of your screen there and then select the appropriate language for you. This webinar will be recorded, and the recording along with the slides will be available on our website, walkcaresfund.wa.gov/webinars, within 24 hours of the completion of the presentation. So we'll start the presentation by defining long-term care and caregiving. So long-term care is help with activities of daily living, like bathing, eating, moving around, and managing medication. It doesn't include medical care, so things like doctor's visits and treatment for medical conditions. Long-term care isn't just for older people. It can also help younger people with disability, maybe an injury or severe illness. And a lot of people think that long-term care means living in a nursing home or assisted living, but it also includes in-home care. as well as other services like home modifications and home delivered meals to help you live at home as you age. In-home care can also support your mental and emotional health in addition to any physical help you may need. A 2025 study showed that home care significantly reduced symptoms of depression for people receiving care. It improved their quality of life and lowered the risk of loneliness. With the right support, most people with long-term care needs can keep living independently in their own homes. It's very common for family caregivers to not realize that they are, in fact, a caregiver. So you might go to your mom's house, for example, a couple times a week to cook meals, maybe drive her to appointments, make sure she's taking her medications, all of which are common care activities. And most of this type of care is provided informally as unpaid care from a family member, could also be a friend or a neighbor. And the reality is that we're all at a high risk of needing long-term care. About 70% of us will at some point need long-term care in our lives. And that risk comes with a high cost. As we can see on the screen there, getting 20 hours of home care each week for 6 months cost about $23,000 total. And even if you do have a family member that is able to provide care, it's important to keep in mind the devastating financial impact family caregiving could have on them. And like we mentioned, because long-term care is not medical care, it's not covered by health insurance or Medicare, except in some very rare circumstances. And it's typically only covered by Medicaid after you've spent down your life savings to just $2,000. And paying for long-term care is a problem faced not just by lower income families. Most of us don't have enough retirement income and savings to live comfortably, and much less to cover the high costs of long-term care. So even if you do have some retirement savings, very few people have enough to get by. As we can see there, 41% of Washington workers near retirement have no projected retirement income from a pension, a 401k, or IRA. Another 42% have no pension and only enough 401k or IRA savings to replace less than 10% of their pre-retirement income. That means over 80% of us don't have enough savings to pay out of pocket for care as we age. A public insurance program like WellCare's gives workers a more affordable way to pay for their long-term care needs by allowing them to contribute while they're working and their income is higher. Then they can access money to pay for the care they need later in life when they're on a fixed income. Covering all workers also helps keep contributions low, and once they retire, their contributions stop. This approach to paying for long-term care is also more affordable than private insurance at the time when people access care. And unlike private insurance, which typically requires you to pay out of pocket for 90 days before you can access benefits, WalkHere's has no deductible or waiting period. So to earn WalkHere's benefits, most Washington workers automatically contribute 0.58% of each paycheck during their working years. And you only contribute while you're working. Everyone is covered at the same low rate regardless of pre-existing conditions. And starting in May of 2026, you'll be able to apply for benefits. You'll need to meet a contribution requirement as well as a care needs requirement. Once approved, you'll be able to choose how you want to use your benefits. The full benefit amount starts at $36,500 and grows with inflation. And you can use your benefits for any covered services and supports that you want. There are no out-of-pocket costs when you need care, so we pay the providers directly for the services you receive with no copay or deductible. So this is what contributions look like over the course of someone's career. A typical worker participating in WA Cares earns about $59,000 a year, and they pay $29 in contributions per month, which adds up to just over $10,000 total over a 30-year career. To earn less in benefits than you contribute, you would have to make an average of $210,000 each year for 30 years. So almost all Washington workers contribute to WACARES. If you don't work in Washington, you won't contribute. Federal employees are automatically not included. Exemptions for temporary workers with non-immigrant visas are now automatic, unless the worker tells their employer that they want to participate in the program. Self-employed workers are only included if they opt in, and employees of tribes are only included if the tribe opts in. Some workers who had private insurance when the program launched have an exemption and do not participate, but for a limited time, this group can choose to opt in to the program. Then, as the table on the right shows, other workers can get an exemption from WACARES if they apply to the Employment Security Department. Some optional exemptions are based on meeting certain conditions, and you must continue to meet them in order to keep your exemption. So this includes workers who live out of state, spouses or registered domestic partners of active duty military members, and active duty military members who also work a civilian job. Veterans with a 70% or higher service-connected disability rating can also choose to apply for a permanent exemption. For more details on applying for an exemption, you can visit wacaresfund.wa.gov/exemptions. So if you are self-employed, you can choose to opt in to the WA Cares Fund and protect yourself with the same affordable benefits available to other Washington workers. Like other workers, you would contribute 0.58% of your net earnings and any gross wages. To earn benefits, you must work at least 500 hours per year. Coverage must be elected by June 30th, 2026, so coming up pretty soon, if you are currently self-employed, or within 3 years of becoming self-employed for the first time. Applications to opt in became available in July of 2023, and you can learn more on our website at wacaresfund.wa.gov/opt-in. So everyone who is contributing to the WA Cares Fund more than 500 hours per calendar year is earning benefits, and that includes part-time and temporary workers. To qualify for benefits, you have to meet the contribution requirement through one of these three pathways. We have the permanent pathway, which will earn someone lifetime access to the full benefit amount by contributing for at least 10 years. Then we have the temporary pathway, which will earn someone access to the full benefit amount if they've contributed for at least 3 of the last 6 years at the time that they apply for benefits. This pathway is designed for people who have contributed recently at the point when they need care, but haven't earned permanent access yet. In 2026, so this year, applicants who have contributed for 3 years at any point in the program can qualify through this pathway. And then we have the transition pathway, which will earn someone permanent access to 10% of the full benefit amount for each year they've contributed. This pathway is specifically for people born before 1968. For example, if you've contributed for 2 years, you'd earn 20% of the benefit amount, or that comes out to about $7,300. This pathway is designed for people near retirement at program launch who might not be able to earn permanent access to that full amount. But these workers can also earn the full benefit amount if they qualify through one of the other two pathways. To use your benefits, we must determine that you need help with 3 or more activities of daily living and will continue to need help for at least 90 days. The activities that we consider are bathing, bed mobility, transferring, toileting, mobility, eating, and medication management. And we'll count any activities that you need supervision to complete, like someone monitoring you, maybe reminding you to start or keep going with the activity, or help you set up. When you're ready to apply for benefits, you'll start by creating an online account. If you need help managing your account, you can set up an authorized user, like a loved one or a representative. And you can also get help with your application from your local area agency on aging, or you can call us to apply over the phone. Once you submit your application, we'll confirm that you've met the contribution requirement, and then you'll be able to schedule an appointment to talk about your care needs. After we meet with you, we'll let you know if you're approved to start using your benefits. There are 2 steps to creating your benefits account. First, you'll use the state's Secure Access Washington system to verify your identity. You can use an existing account or create a new one. Once you're logged into your account, you'll be able to add WaCare's benefits account as a service. This will redirect you to set up your benefits account. You'll enter your name and some basic information like your address and date of birth. And you'll also let us know what language you prefer to use and how you want us to contact you. Once your account is created, you'll select Request a Contribution Determination. Then you'll confirm that the request is for the right person and answer a few questions to help us find your contribution history. You can also select whether you have a legal representative who helps you with medical or financial issues. If you do, you'll upload legal documents to show that they represent you. From there, we'll check your contributions and let you know whether you met the requirement. After we confirm you've met the contribution requirement, you'll get a notification to request a time for an intake call. We use the intake call to get initial information on your care needs, set up your assessment appointment with a Walk Cares team member, and share information on what to expect and answer any questions you may have. We'll also ask about whether you have language preferences or accessibility needs for your appointment. Your assessment appointment will be in person and generally at your home. You can also ask to meet at a local Department of Social and Health Services office if you'd prefer that. You'll meet with either a Walk Cares team member from DSHS or staff from your local area agency on aging. And you can bring one or more people with you for support. We'll talk with you about the help that you need with daily activities and your healthcare needs. You may be able to meet with us remotely only in certain cases, like if you're already receiving hospice care or live in a care facility and already have a plan for long-term care services. And the appointment may take up to 90 minutes. Once you've been approved, you can use your benefits for any covered services and supports from a Walk Cares provider. You may want to choose services to help you stay in your own home. So that can be in-home care, home modifications, home delivered meals, or adaptive equipment and technology. We also cover many services that support family caregivers. So you can get paid care from a loved one, even your spouse, or you can get respite care so that they can take a break. We cover education and consultation to help them manage your care, dementia and behavioral supports, and care transition coordination to support you when you leave a facility like a hospital. You can also choose to receive services in your community, so things like an adult family home or adult day services, or you can choose to receive care in an assisted living facility or nursing home, including memory care. You can get services from any provider who is registered with Walk Cares. To find a provider, you can visit our provider network directory at waclc.org/walkcares. The directory lets you find providers in your area based on the type of service that you want. And each listing will include the provider's name, the services they offer, their contact information, and any additional languages that they offer. If you need help using the directory, you can call us at 844 CARE for WA. You might want to compare multiple providers to find one that works best for your needs. They may have a website listed in the provider network directory that you can visit. You can also call or email them to ask for more information on the services that they offer, the locations where they provide services, their availability, and their prices. You and the provider you choose will agree on the details of the services you'll get, the costs, the dates and times, and any other preferences or needs that you have. Before you start to receive services from your provider, you need to approve a pre-authorization. And a pre-authorization is the official agreement between you and your provider about the details of the services that you'll receive. It also helps us make sure that you have enough benefits available to pay for the services. And once you and the provider agree on those details, they'll send us a pre-authorization with the information you discussed with them. Then you'll get a notification to log into your online account and approve that pre-authorization. For most services, your pre-authorization will last for up to 90 calendar days. And after that, your provider will need to send us a new one. You'll use your online account to manage your benefits. So when you log in, your dashboard, will give you a quick look at the most important areas of your account. So it will show any new notifications that you need to check, any pre-authorizations for services that you need to review and approve, how much of your benefit balance you've used up to that point, and the amount that you have left. And each of those areas will have a link or button that you can click on to see more details. You might be wondering how far your benefit amount will go. For about a third of people need care for a year or less. So for those people, depending on the services that they choose, walk cares may be able to cover all or most of the care that they need. For others, walk cares can provide your family with immediate relief and also time to be able to plan for future care costs. So these are some examples of how you could use your benefits. For example, if you'd like to pay a family member for care, you can receive care for 10 hours per week for 2 years and get care supplies for under $35,000. If you want to make your home more accessible to keep living there independently, you can make home modifications, install a personal emergency response system, and get meals delivered for 3 years for just over $36,000. And if you need short-term help after an accident, you could get in-home care for 20 hours per week for 6 months, install a ramp, and buy safety equipment for less than $29,000. Walk Cares provides a modest benefit for a modest premium. You might want additional coverage in case that you need care for longer or maybe in a more expensive facility. The legislature created standards for supplemental private insurance policies designed to work alongside your Walk Cares benefits. This is similar to how Medicare works. The public insurance provides a foundation of financial security for everyone, And then private options are available for those who want additional coverage. Supplemental private policies will kick in seamlessly once you've used your Walk Here's benefits. The supplemental market will give consumers options for coverage amounts and prices, but policies should be more affordable than current private insurance policies since Walk Cares will be covering the deductible. The policies will also have more consumer protections, and the Office of the Insurance Commissioner will complete rulemaking by May of this year, and policies could become available by early 2027. Here are some key milestones around program launch this year. So in January, we began a pilot program in a few counties to test our processes. As of April 1st, workers and recent retirees who have contributed can create an online account to check annual contribution statements, and that'll be eventually where they can apply for benefits. On May 18th, applications for benefits will open up statewide. And then on July 1st, all beneficiaries can start receiving services. WA Cares is a cross-agency program, so multiple state agencies have a role. The Department of Social and Health Services will process your benefit application and determine your care needs, also manages the provider registration. The Employment Security Department collects wage reports and premium payments from employers and also workers who've opted in. They also manage exemptions and makes contribution determinations for benefit applicants. The Healthcare Authority handles provider payment, and the Office of the State Actuary is responsible for the ongoing financial analysis. So with that, we'll open it up for any questions.
Thanks, Sebastian. If you have a question, you can ask it through the Q&A function found at the bottom of your screen. The first question we have is about out-of-state coverage. How will it work if they're paying in for 15 years and move out of state in retirement?
Yeah, that's a great question. So out-of-state benefits will become available starting in July of 2030. But
Sebastian,
yes.
your voice just almost disappeared.
Okay, let me
Yes, better.
Back.
thank you. I know I've been having some audio issues before, so so for out-of-state benefits, those benefits will become available July of 2030. But anyone who has contributed for at least 3 years um, can choose to opt in and become an out-of-state participant, meaning that if they leave the state, um, maybe if they retire, right, and leave the state, or if they have a job opportunity in a different state, as long as they've contributed for at least 3 years, and then they opt in within a year of leaving the state, they'll be able to either use their benefit or continue contributing depending on their situation.
Questions? Give you a few minutes. Can you explain the pathway for those who were born before 1968?
Yeah. So that was the transition pathway. So anyone born before 1968 will have access to 10% of the full benefit amount for each year they've contributed. So again, someone with contributions beginning July of 2023, if someone, let's say, retired last year, then they could earn 20% of that full benefit amount, which comes out to $7,300.
Any other questions? Um, I'm gonna take a look. I'm looking at the registration form.
I do see a
Um,
question. Oh,
yeah,
sorry.
no, go ahead.
No, the PowerPoint will be available on our website um, this week. So if you visit our website, wcaresfund.wa.gov/webinars, you'll be able to see this recording, the slides, as well as any previous recordings and slides of webinars.
Can you go over again what happens on May 18th?
Yeah, so May 18th is when applications will open statewide. So anyone will who wants to apply will be able to start their application process on May 18th. Again, services won't be able to be received by a potential beneficiary until July 1st.
Any other questions? If you do have a question that you would like an answer to, you can email it to us at wcaresfund.wa.gov/contact, and we will respond to you individually via email, or we have a live chat option there, and you can speak with our customer service team. Next slide. After exiting out of today's webinar, a survey will automatically appear on your screen. If you could take a moment to complete our survey, we would love to hear from you. Next slide. And again, a copy of today's PowerPoint presentation along with the slides will be available on our website at wcaresfund.wa.gov/webinars. You can follow us on social media, Facebook, Instagram, or LinkedIn to stay up to date with the most current information happening in the program. And there's a few contact phone numbers below here. If you would like to contact us, DSHS, for general questions about the program, you can use that URL or call our number. If you have specific questions about exemptions or you're an employer, you can contact ESD at the phone number on the right. We do have some more webinars on our website. You can find them at wcaresfund.wa.gov/webinars. And we'll be doing 2 a month for the next few months, and then we'll have a few conversations webinars through September. If you're interested in attending another webinar, we would love to see you, and you can register on our website. Thank you all for joining us today, and we hope to see you soon at a future webinar.